All right. So that is the idea I wanted you to get about how powerful the public announcement is to increase compliance with your patients in keeping their appointments, because it is now known, the agreement that was made between you and them is now known to at least a third person. And that is an extremely powerful thing. Okay. Now, how do you get friend and family referrals from that patient? Well, the answer really is ask for help at the right time. So here is how I do this. Okay. So after the initial evaluation took place, the public announcement, the agreement, the public announcement took place, and the patient comes in now for at least a week, at least 3 visits, or a week and a half. I would like to see 3 actually sessions, because within 3 sessions, you will have definitely some results in most cases. At that time, we do a reevaluation session. At the reevaluation session, obviously, the question is, how are you feeling? How much better are you feeling? So if the patient is not really feeling any better right now, yet, that is not the right time for you to ask for a referral of a friend or a family member. But if the patient tells you, oh, I feel great, I feel so much better, thank you guys for all the help you are providing to me. So when the patient has good indicators of feeling better and feeling good, has a good experience with your office, then that is the time where you can say, listen, Mrs. Smith, I need your help. And of course, Mrs. Smith is going to ask you, what do you need? And then you say, the way we grow our practice is from referrals of friend and family members of our existing patients. And then you ask the question to Mrs. Smith, who do you think from your family or friends could use our services? And maybe if Mrs. Smith is puzzled a little bit and she cannot answer the question, you may enlighten her at that time about the possibilities of physical therapy. Maybe at that point, you may ask some questions such as, does anybody have back pain, neck pain, osteoarthritis, any numbness, tingling, weakness? So you can probe this type of questions so that you can give them, once again, some better reality and better understanding about physical therapy. Don't make assumptions that they will know, because they may not. So then why patients will stop coming to physical therapy? Well, there are 2 possibilities. Either they're still in pain or they are out of pain. So let's take the possibility that they are out of pain. That is fantastic. Very good job. But you know what? The fact that somebody stops feeling pain, should they stop coming to physical therapy? Have you completely finished everything you had to do just because the patient feels no longer pain? No, you have not finished your job. As a matter of fact, your job is not finished until you do that final visit, final care visit with the patient, and you prescribe to them, let's say, a long-term home exercise program. So again, you have to call, get the patient back in for continuation of care and for that final visit. But what if the patient is still in pain? What if after so many visits, you have not managed to really resolve the patient's problem? And the question is, did you get the right diagnosis and did you perform the most appropriate treatment for that patient? Well, how did you derive to the physical therapy diagnosis? Yes, you got a script, perhaps, or not, from the doctor. Now, in more and more cases where there is direct access, there is no a script, or there might be a very generic script, treat the neck or something like that, without any other specifics. How did you derive to this diagnosis? Well, you followed the model, the current model for physical therapy, where you did a physical therapy evaluation, you created a treatment plan, an intervention, then a reevaluation, continuation of PT until you had the end of care. And that formation of a treatment plan was based on specific evaluative procedures that you did. You did range of motion, you looked at manual muscle test, but also you looked at many different orthopedic and neurologic tests. We call them special tests. And your ability to identify the proper diagnosis on that patient is contingent to how appropriately these tests can screen for a condition. Screening of a condition relates to the sensitivity of a specific test. That's why we use many times combinations of tests. But you can see here how low sensitivities we have in some of the most prominent orthopedic and neurologic tests that we do. For cervical radiculopathy, for God's sakes, the sensitivity of Sperling's test, which is probably the number one test that we use for neck patients, is 30%. This means that it opens the door for 70% of the patients who do have a confirmed cervical radiculopathy for the Sperling's test to be negative, not to be able to identify the condition. You get a false negative. So how about a false negative? Is it okay to have a 70% false negative? Just imagine that the coronavirus test had a 70% false negative percentage. Would that be a good test? Would that be reliable? Would you like to go and get a COVID-19 test knowing that you have only 30% chance for that test to show you that you have coronavirus if you do have coronavirus? Not very good, right? So alternatively, you can use the new paradigm in physical therapy. This is what we have been using. And the new paradigm in physical therapy, which includes diagnostic testing, such as EMG, ultrasound, and other tests within the realm of that PT evaluation or right after it, that type of testing provides much higher percentages of sensitivity. And therefore, we are able to identify conditions that otherwise we wouldn't have identified just with the regular physical examination tests. As a matter of fact, we published a study earlier this year, and that study specifically for electromyography testing was done on 462 patients, and it identified that in 60.61% of patients who received EMG nerve conduction studies, the management, their physical therapy management changed because of the results that we got from the diagnostic testing. So you see how important that can be and how it can affect outcomes that we will receive from the physical therapy treatment, from the physical therapy care. And these are the types of tests that you can do diagnostic-wise as a physical therapist, and they are reimbursed to a physical therapist. So, as I said in the beginning of my presentation, I will discuss with you ideas on how to increase your reimbursement rates, right? And as part of compliance, as I mentioned, is having that patient to also buy into these additional type of things that you believe as a physical therapist this patient can benefit from. That's part of complying. That's part of a compliant patient. And there are many different things that can have a clinical value, and at the same time, it can offer additional revenue to your practice, such as laser, doing a private exercise gym services, nutritional products, wellness services, vitamins, other white labeling products. Of course, in my case, I am very biased in the area of diagnostics because this is what I have been doing, and I have been helping many others around the country to do. And they have increases in per visit reimbursement anywhere between 25 to 47% in terms of increase in reimbursement per visit as a result of performing diagnostic testing. So patient compliance can have very important and many different effects in the physical therapy practice, both clinical effects as well as financial effects. I'll be happy to entertain any of your questions as you are typing them in the chat section right now. And I am going to enter right here my email address, which is dimi@handsonpt.org. If I don't get the chance to answer all of you who are typing right now in the chat section, please feel free to email to me, and I'll be very happy to answer back to you. Once again, thank you very much for attending this presentation, and Chad and Carl and the rest of the Breakthrough team, thank you for the amazing job that you are doing in helping all people in private practice achieve better conditions for their patients and for their practices and for the future of physical therapy.